Every year, over 2.4 million Americans are believed to use nitrous oxide, laughing gas, recreationally. And in the UK, it's thought to be the second most popular controlled substance used by 16 to 24-year-olds. And recently in the news, Kanye West has been making headlines, with his erratic behavior being blamed on him misusing nitrous oxide. But nitrous oxide has also been safely used for pain relief in medical settings for well over 100 years. And so, should we be concerned with this growing trend of recreational nitrous oxide use? Let's dive into that. For those of you who don't know me, I'm Dr. Josef Witt-Doerring. I'm a board-certified psychiatrist and expert in side effects from psychiatric medications. Nitrous oxide is used medically to reduce pain and anxiety, but it is used recreationally more for its ability to cause dissociation and euphoria. In 2019, nearly 13 million Americans over the age of 12 reported having used it recreationally at least one point in their life, according to SAMHSA data. Part of its popularity is due to how cheap and easy it is to obtain. Canisters of pure nitrous oxide are sold as propellants for whipped cream dispensers, hence the street name Whippets. Although officially a cooking product, if you search for it online, suggested purchases will often include items that are used to inhale the gas recreationally, things like balloons and masks. And it is the case now that its use has been normalized on social media. Yet very few people actually know the risks of this product. For instance, a 2018 survey showed that 91.6% of those who had heard of recreational nitrous oxide use were not aware of any of the side effects. So what are the dangers of using this product? Well, using it recreationally is very different from using it in a medical setting, because in a medical setting, nitrous oxide is mixed with oxygen and it's used under supervision. However, when people are using it recreationally, they're inhaling pure nitrous oxide, which actually starves the brain of oxygen and can cause blackouts, seizures, or even in some cases death. Now, if other central nervous system depressant drugs are used at the same time, things like alcohol, benzodiazepines, or opiates, this suppresses reflexes and it increases the risk of someone falling, choking, or even stopping breathing. And there are also other physical risks depending on how you inhale the nitrous oxide. For instance, if you inhale it directly from the canister rather than dispensing it into a balloon first or using a mask, you can actually risk puncturing your lungs due to the high pressure at which the gas is released. Furthermore, frostbite injuries have also been reported when people have inhaled the gas directly from the canister, as it can become very cold when the gas is expelled. Now moving on, let's talk a little bit more about the dangers of chronic use. Now many people may assume that there are no long-term risks associated with this drug because it induces a very brief high. Typically it only lasts 1 to 2 minutes. And because of that, many people think that this could not be associated with long-term consequences. However, that's not the case, because if you are using nitrous oxide frequently, it's going to react with vitamin B12 in the body, and it actually inactivates it. And long-term, this can lead to B12 deficiency. Now, B12 is a really important vitamin for the body, and when you lack it, it can lead to numerous problems around the body. For instance, blood vessels can become damaged, and it can increase the chance that you go on to have a thrombosis or a blood clot. Furthermore, B12 is also needed for the maintenance of myelin sheaths. Myelin sheaths are the coatings on your neurons, and when you lose the myelin sheaths, you develop a whole range of neurological problems, such as forgetfulness and brain fog. And some people who chronically use nitrous oxide can go on to develop something that looks like dementia. On top of the cognitive problems, people can develop symptoms of weakness, paralysis, and even bladder and bowel dysfunction. And unfortunately, with the increased use of nitrous oxide, doctors are seeing more and more young people in emergency rooms with alarming neurological symptoms. Currently, the true prevalence of neurological symptoms in nitrous oxide users is unknown, as many might not seek help or may report only milder symptoms. And although severe harm is usually associated with large exposures to nitrous oxide, there are reports of neurological side effects even from people who lightly use the substance. So is this drug addictive? Well, to be honest, recreational nitrous oxide use is poorly studied, but many heavy users will show signs that fit the criteria for a substance use disorder, such as having cravings, using more nitrous oxide over time, and spending more time obtaining, using, and recovering from usage. And one study of over 400 patients with nitrous oxide use disorder found that 55% of them had relapsed 6 months after first presentation. That's a pretty high amount, which means this drug likely is quite addictive. Now, while coming off this drug does not seem to cause the same physical withdrawal or dependence problems seen with things like opiates and alcohol, it does appear to cause a fairly strong psychological addiction, which is not unexpected because it immediately causes an intense euphoria after you use it. Now let's talk a little bit about how nitrous oxide use can be confused with some psychiatric conditions. Well, when you use a lot of nitrous oxide, the acute side effects of it and the long-term side effects of it can overlap with symptoms commonly seen in mental illness. Things such as hallucinations, psychosis, delusions, anxiety, and even depression. And these symptoms can occur without signs of neurological damage or in those without a B12 deficiency. And in fact, it's really hard for doctors to even know you're using it because nitrous oxide leaves no trace in the system. So unless a doctor asks someone about their use, they're not going to find out about it. Unfortunately, if someone is having side effects from using this drug, they could present to the emergency room with a psychosis or an anxiety disorder, and they could easily end up being misdiagnosed as having a severe mental illness and consequently ending up on medications that they don't need, potentially for a very long time. Now let's talk a little bit about Kanye West because he's been in the news a lot recently. Now, the first time I heard about the possible allegations that he was using nitrous oxide was back in 2024 when newspapers reported that a celebrity dentist was allegedly supplying him with nitrous oxide. And if you've been paying attention to the news recently, over the last couple of months, we've been seeing a lot of very erratic and bizarre behavior from Kanye West, especially on Twitter. And I think the most well-known controversy was when he appeared on a Super Bowl ad with a link to his website where he was trying to sell SWAT sticker t-shirts. He then backtracked on it and he apologized. But all of this behavior was suspicious of someone that really wasn't in his right mind. And following these controversies, it appeared in the news that apparently he had relapsed after some dental work was done and he was allegedly abusing nitrous oxide again, and this was the reason for his bizarre behavior. It's really hard to know what's happening with Kanye because I know there's been suspicions that he has a diagnosis of bipolar disorder or that there could be some other substance use disorder. I'm not his doctor, so it's really hard to tell. But what I would say is that both of those things would be on the table. I mean, it could genuinely be a psychiatric problem, or this could be manifestations of essentially using nitrous oxide. And so what I'd say to this is that if he is using nitrous oxide, it's entirely possible that this could be contributing to some of the strange behavior that we've been seeing online recently. And worryingly, if this is what's going on, it is concerning that it could potentially lead to lasting damage. So what do people need to know about nitrous oxide use? Well, firstly, you need to be aware of the dangers of it because it isn't a benign thing to use. And many people think it is because the high is so short. But if you're using it especially frequently and over a long period of time, this can compound and cause a whole range of psychiatric problems. And so stop using nitrous oxide. Yes, you're probably going to be okay if you've done it once or twice at a party or something like that. But as soon as it gets to the point where you are buying canisters and you have them in your house and then you're using them regularly, you are putting yourself at serious risk of potentially developing some neurological damage and potentially psychiatric problems as well. If you are using nitrous oxide, stop using it and then go and see a doctor. You may be low on B12 and you may actually need some B12 injections to supplement this to allow the myelin sheaths in your body to heal and to arrest any neurological problems that are occurring because of the damage to the myelin sheath. So in closing, what I want to say is that the issue with nitrous oxide isn't just about one celebrity who may be having a problem because of this. It's about a growing public health crisis. Emergency room doctors and psychiatrists need to be aware that nitrous oxide use could be causing young people to present with symptoms of a new mental illness. Nitrous oxide users also need to take the warnings seriously and they need to get checked for vitamin 12 related nerve damages. It could be the difference between essentially having some neurological damage and maybe even ending up on a psychiatric medication with an incorrect diagnosis that could seriously change your life. If you like these videos where we explore the risks of recreational drugs, you're not going to want to miss this video right over here where we talk about the long-term effects of cannabis and how it can lead to psychosis and even things like schizophrenia and bipolar.